Before we begin, I want to share some background information on why we've been doing this webinar series. In January of 2016, about 24 healthcare professionals began developing a strategic plan for statewide cardiovascular health. It was finalized and implemented in 2017, and the current version of the plan is what you see here. It can also be found on the South Dakota Department of Health's website, listed at the bottom of your screen, and we will also include that in the chat box. During the process of developing the strategic plan, 4 different goal areas were identified, as denoted by the different colored columns you see here. Each of the four goal areas has a work group working together towards the area's designated strategies. In recent years, the Priority Population Goal Area Work Group has prioritized focus on maximizing community clinical linkages, such as community health workers' profession. As a result, the Priority Populations Group decided to develop this webinar series to provide additional training for South Dakota's healthcare professionals and organizations related to community health workers. To learn more about the South Dakota Department of Health and what we are doing around community health workers, we encourage you to visit the Community Health Workers page on the Department of Health website. You can access this page via the link that has been added to the chat box. Here you can find a compilation of resources to assist with the awareness and promotion of CHWs in South Dakota. As I mentioned earlier, this is our second installment of the CHW webinar series. The first webinar is archived on the DOH website and was hosted last spring. It focused on community health workers, who they are, and what they can do for you. Our third webinar in this series is going to take place this spring, so please stay tuned for announcements on that webinar. We also would like to encourage you to download and use the Community Health Worker Reference Guide, which is a handy guide providing an overview of CHWs and features a case study from the Bridging Health and Home program at Sanford Health in Webster. Now, I am happy to introduce our featured speaker for today's webinar, Samantha Hines. Samantha is the Policy Strategy Manager for the Department of Social Services Division of Medical Services. She has been with the state of South Dakota since 2013 and with Medical Services since August 2019, supporting preventative health initiatives. Sam has an MPH from the Grand Canyon University and an MSW from the University of New England. I'll turn it over to you, Sam.
Thanks, Larissa. Can everybody hear me all right?
Yes, we hear you great. Thank you, Samantha.
Okay. All right, we just wanted to start off by thanking Larissa and the Department of Health for the opportunity to present today and to talk about Medicaid and our CHW program. And we're really excited about the possibility of expanding community health worker providers in South Dakota. My plan for the presentation today is to give you a brief overview of South Dakota Medicaid, talk a little bit about the community health worker service and what it looks like in the Medicaid program, give you a little bit of information about how to enroll as a community health worker provider, and then we have some additional resources, and we'll have plenty of time at the end for questions. So South Dakota Medicaid is one of South Dakota's largest insurance providers. During last state fiscal year, Medicaid covered just over 144,000 unduplicated recipients, which averages out to about 117,000 recipients each month. Primarily, Medicaid is serving low-income children in foster care. We do cover some adults, but it's limited to adults who are elderly or disabled, pregnant women, and low-income families. And you can see from the chart here, we are primarily serving children. About 1 in 7 South Dakotans in any given month are covered through the Medicaid program. 1 in every 3 children under the age of 19 has coverage through Medicaid. And about 50% of children born in South Dakota will be on the Medicaid program during their first year of life. So we are really reaching a large number of people in our state. Community health worker services were added as a Medicaid service in April of 2019. The goal really of our community health worker program is to prevent disease and disability or other health conditions, as well as help people to self-manage chronic conditions. Some of the conditions that are covered through our community health worker program include mental health conditions, substance use disorders, cancer, diabetes, heart disease. It also covers high-risk pregnancies, tobacco users, and people who might be using multiple medications or 6 or more different classes of medication. Community health worker services can also be used for people who may have a barrier that would impact their health care, but may not have one of these covered conditions. If someone has a barrier to health care, we would just need to see a risk assessment that identified what the barriers to health care might be. Some of the covered barriers could include geography and the distance someone is from a healthcare provider that they need. It could also include cultural or language barriers that may prevent someone from following medical recommendations from their provider. In order for a recipient to receive community health worker services, the service would need to be ordered by a physician, physician's assistant, nurse practitioner, or certified midwife. The service would also need to be a part of a recipient's care plan that could be written by the community health worker or by the referring provider. That care plan should be reviewed every 6 months with that care team, specifically the provider who is referring the recipient to services in the first place. The services must be provided face-to-face. In South Dakota, face-to-face can include telemedicine. The stipulation there is that telemedicine must have both an audio and a visual component. Services for community health workers can be provided in both group and individual settings. The group settings are limited to a maximum of 8 people. And this is just important to note as we get later in the presentation and talk about reimbursement. The reimbursement for community health worker services is different based on the type of setting it's provided in, but we'll get more into that in a little bit. Community health worker services are primarily including things like health education, promotion of health, disease and illness prevention. It can also include helping recipients navigate health systems, find providers, and make appointments with those providers. It can also include things like accident prevention, education about immunizations, tobacco cessation, and other activities related to chronic diseases and helping people to manage those chronic conditions. There are a number of services that a community health worker cannot get reimbursed for in the Medicaid program. And some of those services include transportation, case management, translator services, childcare, employment, companionship. I realize some of these services are things that community health workers are doing and some of the agencies around South Dakota already, and you can continue to provide those services. You just can't submit the reimbursement for those non-covered services. One of the things that we'll get into as we get further into the presentation is some of the policies that are required for a community health worker agency. One of those policies is around the scope of work that a community health worker can provide. And this is just, these non-covered services are important to keep in mind when you're looking at policies related to the scope of work for a community health worker. We have quite a bit more information about what services are not covered by the community health worker and which ones are in our South Dakota Community Health Worker Provider Manual. I've provided a link at the end of the presentation to that manual, and it can provide a lot of really great information about what community health worker services look like in the Medicaid program. One of the requirements for a community health worker in our Medicaid program is that they have to be certified through a community health worker curriculum. Our office has recently been working to expand the number of curriculums that are approved in our state in order to get more agencies to enroll as Medicaid providers. The Indian Health Service Community Health Representative Program has always been one of our approved curriculums, as well as any program that's been approved by the South Dakota Board of Technical Education and the South Dakota Board of Regents. In the last couple of months, we have added 3 additional curriculums to this list to include Family Spirit. Family Spirit is an evidence-based home visiting program that is specifically for Native American families. It was created by Johns Hopkins. The program is targeted to pregnant women, and the program goes until the child is 3 years old. It primarily focuses on behavioral health, preventative health for children, family planning, and substance use disorders. We're doing some work right now with the Family Spirit providers in South Dakota to help them get enrolled as South Dakota Medicaid providers. And if you'd like more information on that, we have a meeting coming up in February for Family Spirit programs. And if you are part of that program and would like more information, you can reach out to me and I can get that sent to you. We have also approved the Better Choices, Better Health program. It's a chronic disease self-management program in South Dakota designed to help adults living with ongoing physical and or mental conditions, as well as to help caregivers understand how healthier choices can improve quality of life, boost self-confidence, and inspire positive life changes. So this is a program that's now approved for reimbursement in Medicaid as well. The final program that we've recently approved is the National Diabetes Prevention Program. This is a Center for Disease Control Recognized Lifestyle Change Program focused on healthy eating, physical activity, and is meant to prevent or decrease the risk of developing type 2 diabetes. One other thing to note with the addition of these curriculums is that several of them are kind of a set time frame. Like I mentioned, the Family Spirit, for example, starts during pregnancy and goes until the child is age 3. Even though it's a set curriculum, in order to get reimbursement from Medicaid, the provider or the recipient would still need to get a referral from their primary care provider or whoever their physician or nurse practitioner or whoever that person might be. So that's important to consider with these programs that have a set time frame. If there are other curriculums that people who are on the webinar now think would be appropriate for reimbursement and consideration under the Community Health Worker Program, you can get in contact with me. My contact information is part of this presentation. We're always willing to consider and look at different curriculums to be added to this. We're always looking to grow our Community Health Worker Program. We think it's a huge benefit to our Medicaid recipients. So if you have anything, feel free to share it or reach out to me. So I'll go now into a little bit about Medicaid reimbursement. The Community Health Worker Service is billed using CPT codes, and the 3 codes that you can bill under Medicaid are listed here, along with their rate of service. This is the rate for 1 unit. 1 unit is the equivalent to 16 to 45 minutes of service, and 2 units is 46 minutes or higher. There is a limit to 2 units, or for a recipient to have 2 units billed during a single day, and it could be any combination of those three codes. There is a limit of 104 units or 52 hours of service in the plan year, which begins July 1st and goes through June 30th. I did want to mention a little bit about our Medicaid portal. Any of our Medicaid providers have access to the Medicaid portal. Through the portal, you can check whether or not a recipient is eligible for Medicaid services, which is really important to check on a monthly basis. A recipient's eligibility can change from month to month. And I wanted to remind providers to do this, again, when you're thinking about some of those curriculums that I mentioned where there's a set time frame, that you should be checking to see if a recipient is eligible, because they might not have eligibility for the full span of the program. Through the Medicaid portal, a provider can also submit their claims for reimbursement. The community health worker service is billed on a 1500 claim, which can now be submitted online through the portal. You can also check the status of claims if you have questions about those. At the end of the presentation, I have included a link to our Medicaid portal guide. It kind of walks you through all the different steps for using the portal. So that's a resource at the end of the presentation. So when it comes to Medicaid enrollment, we enroll a Medicaid provider agency. We are not able to enroll individual people. So an agency will hire community health workers to provide the service, but it's the agency who is enrolled as a Medicaid provider and would be responsible for doing all of the billing and all of the enrollment procedures. In order for a provider to enroll in Medicaid, they would complete an application on our SC MedX site, which can be found at the link I've included on this slide. It's got all of the information that a provider would need to know what to do and what to submit to become a Medicaid provider. There is some additional documentation that would need to be submitted in addition to the application. And then for community health worker services in particular, there is a supplemental addendum. This is a document that is reviewed and signed by the agency that is looking to become a community health worker provider. This supplemental addendum also includes all of the policies that would need to be submitted and reviewed by our office prior to enrollment. There are a couple different resources for anybody who's interested in becoming a Medicaid provider. The information that I've listed here is the email address and the phone number for our provider enrollment team. So if there are questions about how to fill out the application, or if you're already a Medicaid provider and you'd like to just add community health worker services to the list of services you provide, you can contact the provider enrollment team at the contact information here, and they can help walk you through that process. On the other hand, in regard to the community health worker policies, I am available to provide any technical assistance and help to review policies for any agency that is wanting to become a community health worker provider. I've been providing technical assistance to a couple of agencies in the state already, helping them to review their policies and make sure they're in line with the requirements that the Department of Social Services has for enrollment. And I am available to do that for any of the agencies here on the phone today. I have done both face-to-face technical assistance as well as over the phone, and can provide any feedback on your policies and help you walk through the process of becoming a community health worker provider. And again, my contact information is included with the slides. A little bit more information about that community health worker supplemental agreement, as well as the policies that would need to be submitted. This is the list of all of the policies that we would review. There is more detailed information about what we require in all of these policies, but I'll give you just a brief high-level overview. We're looking for policies on abuse, neglect, and exploitation, how community health workers can identify abuse, neglect, and exploitation, identify prevention methods, as well as identify the mandatory reporting and how they should be reporting that within your agency, as well as to police or other entities as required. We're also looking for a staffing policy. What are the qualifications of the people that you're hiring as CHWs, background screenings, making sure that they have certification through one of those curriculums that we talked about in an earlier screen. Also making sure that they're not on the Office of Inspector General list or any prohibited, or haven't done anything that would prohibit them from employment. And there's also a staff training policy that requires cultural competency, chronic disease, education on chronic diseases. That also requires that there's 6 hours of continuing education annually. And there's also a couple of policies on this list that would require you to do training with your staff annually, and that would be abuse, neglect, and exploitation in the scope of services for a CHW. We would also look for a policy on intake and admission. What's your process for responding to a referral from a physician's office? What's the time frame for doing that? And are there any reasons why your agency would decide not to respond to a referral or to provide services to an individual? There's a requirement for a discharge policy. This is covering 2 different things. One, if someone no longer needs the service, no longer needs CHW services, they've met their goals outlined in their care plan. It also should cover anything related to if you need to stop services early. For example, if there's some sort of unsafe condition for the community health worker and they can no longer provide the service anymore, what are the conditions that you're going to do that, and what time frame are you notifying the recipient that you're not going to provide the service any longer. We also look for a confidentiality policy and your HIPAA regulations, which most everybody has already. We're also looking for recipient rights and responsibilities. So this could be, just what are you expecting of recipients from your program, what responsibilities they might have to make sure that they're coming to appointments and things like that. Again, I think most healthcare providers already have a recipient rights and responsibilities. If you'd like to see an example of one, we do have Medicaid rights and responsibilities, part of our Medicaid handbook. I don't believe I included that in the resources, but I can certainly get that added and sent out to this group. We also look for a policy on documentation. What services are you providing, the date and scope of the service that's being provided. We look for an emergency response policy and what the CHW should do. For example, if there's an unsafe condition going into a recipient's home, or if a recipient, had a heart attack in the middle of one of the sessions, and what your policy is around that. We look for your universal precautions and health and safety policies, quality assurance policies, and how you're going to review recipient records, as well as incident reports, and monitor and correct any issues that might be going on within the program. And then finally, we're looking for a policy on the scope of services. And like I mentioned before, how are you identifying what is billable and covered under Medicaid or other funding sources, and which services are not? So the supplemental agreement, like I mentioned, has more detailed information about what specifically should be in each of these policies, and kind of outlines what you need to do to submit these as part of provider enrollment. Again, I will offer my technical assistance. I can review any policies from any agency to see if they're in line with what we're looking for, and provide feedback on where we would recommend changes to be in line with our policies. And you can contact me for that information. I've created a couple of handouts as well that would help an agency go through their policies and go through the provider enrollment process. So you can contact me for that. So once someone's provider enrollment application has been approved, you're able to go through and start billing for the service. I know Medicaid billing can be complicated sometimes, So if there's any technical assistance needed related to billing and how to do billing when you first enrolled, you can certainly reach out to us and we can go through that as well. I've gone through this a little faster than I had planned, but so we'll have plenty of time for questions. The last thing I have here, like I mentioned, is some of the resources that we have through our Medicaid office. We have the provider manual that goes through covered services and non-covered services, as well as some of the billing components for community health worker. We have the fee schedule listed here for this current fiscal year. These change from year to year, so you can get updated fee schedule information on our website. We have some of the training information on the Medicaid portal and how to do Medicaid billing, how to check recipient eligibility. That can all be found on that link, as well as instructions on how to bill on the CMS 1500 form to do community health worker billing. So I guess I can open it up to questions.
Yes, thank you so much, Samantha, for your presentation. We will now take a few minutes to address any questions that have come up during today's presentation. First, we want to encourage you to write down Samantha's contact information, and we will definitely send that out after the webinar as well. And we will get to questions. Thank you to those who have submitted your questions. The first question is, will we have access to this informative PowerPoint? Yes, we will send out the PowerPoint slides as well as a few of the handouts that Samantha mentioned during her presentation. While we are waiting for questions to come in, we also encourage you to take a moment to complete the evaluation for today's webinar. The link has been added to the chat box, or will be added shortly. So we have a question for you, Samantha. Does DSMES and DPP have to be nationally recognized to be reimbursed?
I believe they do have to be nationally recognized in order to get reimbursed. And I have been working a little bit with the Department of Health on the NDP program, and you know, seeing if it would be appropriate for this, and it really should be part of the nationally recognized group to get reimbursement through Medicaid. If there's additional questions on that, maybe we can set up some time with the Department of Health and maybe talking through some of those specifics related to the NDPP. We don't currently have anyone enrolled who is an NDPP provider.
Excellent. We have a few more questions for you, Samantha. We have a question to clarify the Better Choices, Better Health reimbursement for community health workers. Does the Better Choices, Better Health training qualify the community health worker as a trained CHW for state requirements, or is it at the time spent facilitating the Better Choices, Better Health curriculum reimbursed as a patient-facing service?
So the community health worker agency has to have all of the people that they're employing as community health workers have to have the certification through one of those programs. So I would say yes, they would have to be trained through Better Choices, Better Health.
Okay,
does that
excellent.
answer the question?
Yes, it does. Thank you. Okay, we have a couple more questions that have come in. First, is the reimbursement amount the same for any of the curriculum as long as the time is the same? For example, is 30 minutes of DPP equal to 30 minutes of BCBH?
Yes, the reimbursement is the same across the board regardless of what the curriculum is.
Awesome. How How many community health workers are currently in the state of South Dakota seeing clients, excuse me?
That's a good question. We are working on enrolling our first community health worker providers in the Medicaid program right now. There are other people who are doing community health worker services across the state, but not billing Medicaid. So I don't know if maybe Larissa or someone from the Department of Health might be able to speak better to the number of community health workers we have in the state. But I can tell you we are enrolling our first community health workers in Medicaid currently.
So I can elaborate a little bit more. We know that there are others through partnerships that we have that are providing CHW services, like Samantha mentioned. We don't have a formal way of collecting that information at this time. However, I can say we are working on really helping build support for that profession, and I think in time we will have a better way of knowing, who the CHWs are in our state, what organization is hiring them, and kind of the areas that they are in. So unfortunately, we haven't set up a way to track that at this time.
Thank you, Samantha and Larissa. The next question we have is, can you elaborate on the approved curriculums like Better Choices, Better Health, and how it works?
I might defer this one to Larissa to talk about the curriculum of Better Choices, Better Health. But from a Medicaid standpoint, like I said, we're really just looking for the certification from that program, or through any of the other curriculums for a community health worker to get reimbursed in Medicaid. But I don't know all of the fine details of the actual curriculum.
I think Megan, thank you, Megan Jacobson with SDSU Extension, who is our lead point of contact with SDSU Extension for the BCBH workshops. She's commented here in the chat box a little bit more information around that. I certainly don't have the details or finer details of that program either, so I would defer that question to Megan Jacobson. We can certainly get you in touch with that individual.
Thank you, Larissa. We had a couple of questions that came in via the registration portal, and so I'm going to shift to those now as we wait for other questions to come in. Can you provide additional information about transportation, and if transportation services are an allowable service under community health worker reimbursement? Samantha?
No, transportation is not an allowable reimbursable service. We know that there are several agencies, specifically like IHS and the Community Health Representative Program. I know there's a lot of those agencies that are doing transportation, and they can continue to do transportation. They just wouldn't get reimbursed through Medicaid. That's one of the CHW non-covered services.
Excellent, thank you. Another question we had related to community health worker services in a group setting. Can you talk more about when community health workers are working in a group setting, if all members of the group have to be Medicaid recipients?
That's a great question. They do not all have to be Medicaid recipients. There are some regulations about what you can, let me go back. There's no requirement to have Medicaid recipients or to have the group be all Medicaid recipients. Yeah, there's a little bit of additional information about that in the manual, but no, they do not all have to be Medicaid recipients. You would still bill the group rate though when you're doing your claims.
Excellent, thank you. We have a question related to the DPP program. Is it a covered benefit if it's being offered in the healthcare setting and by healthcare professionals?
I believe it would be. I will have to double check a couple things on that, but it should be. the healthcare setting would just need to enroll as a community health worker provider.
Okay, great, thank you.
But I can do some additional follow-up on that.
Awesome, thank you so much. And we have another question for you. If we want to access the portal, how can we do this?
You'll have to be an enrolled provider. And if you are an enrolled provider and are having difficulty getting access to the portal, we can certainly work through that.
Awesome. Another question for you, Samantha. Can you provide clarification on what the community health worker programs that are approved by the South Dakota Board of Technical Education or the Board of Regents are?
I think it's just one that's offered through Lake Area Tech at the moment, but we would support any program that was done through the South Dakota Board of Regents or the technical education, any of their degree programs for community health worker.
Excellent. We have a question of asking if you could just briefly share what convinced the Office of Medicaid to cover community health worker services. For example, what data did you all look at and from whom?
You know, that was a little bit before my time here. I can certainly gather some information about why we chose community health worker services. I can tell you that part of the reason we got into community health worker services kind of goes back to some things we've been doing with services for Native Americans and getting 100% federal reimbursement. So typically Medicaid services are paid for partially by the federal government and partially by the state. And so for services for American Indians, we've been getting 100% federal funding, which has allowed us to expand some of our other services in Medicaid. And so we added community health worker services at that point.
Thank you so much, Samantha. We have another minute or two for questions. If there are any additional questions that you'd like to submit, please do so at this moment in the Q&A box or chat box. We'll give you another couple of seconds. Great, we have another question that came in. Samantha, is there a sample job description for community health workers?
South Dakota Medicaid does not have one. I think this might be something Department of Health might be working on, but I'll let Larissa correct me if I'm wrong.
Yeah, I'll jump in and answer this one. So a little bit ago, I alluded to the Department of Health assisting, kind of supporting the onboarding of support for community health worker professions in our state. And so what that means is we are contracting with a organization that's going to help do some of this work for us and really kind of look at some of the resources that are needed, one being, you know, a sample job description so that anybody, an organization, healthcare provider who is looking at wanting to employ and onboard a CHW can take a look and use this sample template to work off of when they're providing that job description to put out there. So certainly a resource that we have heard from providers who are already kind of on the fence but needing additional assistance in this area. So definitely a resource that you're going to see come out here in the next year. Excellent.
Well, that concludes the questions that we have at this moment. Larissa, we will turn it over to you. And just a reminder to please complete the evaluation for today's webinar. Larissa, I'll turn it over to you.
Thank you. In closing, I'd just like to thank you all for joining us on this webinar today and for your interest in learning more about community health workers and for possibly working with them in your organization or facility. We definitely want to thank all of you for the work that you do to help keep our South Dakota residents healthy. If you'd like to find out more about the work that we are doing in regards to CHWs, if you're interested in joining the Cardiovascular Collaborative, or if you would like to discuss potential opportunities to partner on CHWs, please don't hesitate to reach out to me using the information that is listed here. Again, I just want to thank you for joining us today and have a great day.